start your speech, you can go live now.
Good afternoon, everyone. Welcome to Cancer Reach. Cancer Reach is initiated by Dr. Krishnamani to spread awareness about the cancer and help the caregivers and patients to access the right treatment on right time. We are privileged to have Dr. Krishnamani with us, a true pioneer in the field of oncology, a tireless advocate for lung cancer awareness and for countless patients and their families. Dr. Krishnamani is an esteemed expert in the field of oncology with more than 10 years of experience in treating different types of cancer. Dr. Krishnamani is associated with American Oncology Institute of Hyderabad. As you all are aware, November is recognized globally as Lung Cancer Awareness Month. Lung cancer remains one of the most prevalent and deadliest form of cancer worldwide. Through this initiative on lung cancer awareness, we aim to provide valuable information to the public. So please join us to give a warm welcome to Dr. Krishnamani. Doctor, requesting you to give some introductory remark to this session.
Hello everyone, welcome to Cancer Reach. As already mentioned, this is an initiative to spread awareness about cancer, and we are having live sessions almost on every Friday between 3:30 or 3:34 to spread information on cancer. November being the Lung Cancer Awareness Month, we shall spend a few sessions on increasing awareness about lung cancer, screening, early detection, how to prevent risk modifying behavior like stopping smoking, and some new treatment advances in lung cancer.
Thank you, Doctor. So during this critical month, let's come together to raise the awareness about the lung cancer. So without any delay, let's commence this informative live session on Lung Cancer Awareness Month. Doctor, what is lung cancer?
So lung cancer is any cancer which starts in the lung. Okay, so it is the primary lung cancer. We are not talking about a cancer which spreads to the lung. That is called metastasis. So the cancer starts in the lung, and it can be in the lung or it can spread to other organs. This is one of the most common cancers we see in the world today, and the incidence or the number of new cases is increasing day by day. Uh, the Western world had a lot of prevalence of lung cancer earlier. It even has now. But in India too, we see a lot of lung cancers. And it is not that only men and smokers develop lung cancer. We see a lot of women and women who do not smoke also developing lung cancer. So in a nutshell, we are talking about a very, very common cancer which happens both in men and women, and more common in smokers, but also happens commonly in non-smokers.
Doctor, what are the causes of lung cancer?
So the risk factors for lung cancer are, as we discussed, smoking. So somebody who has a very heavy history of smoking, we call it pack years. One pack year, if you talk about cigarettes, is if somebody smokes one pack every day for 1 full year. If somebody smokes 5 packs every day for 10 years, 5 into 10 is 50 pack years. So the number of cigarettes you smoke, if it increases, if your number of pack years increases, your risk of lung cancer increases. Other risk factors are passive smoking. Somebody is smoking in the house constantly and you're inhaling that smoke. Another important risk factor is people who work in asbestos factories. They get lung cancer and other cancers like mesothelioma. Radon exposure is a cause for lung cancer. Air pollution is also been said to cause lung cancer, and in many cases, we don't know the reason. So, the common causes are smoking, asbestos exposure, passive smoking, air pollution, and in some cases, we don't know the real reason for lung cancer. But the risk increases with the number of cigarettes one smokes, which is called pack years.
That was quite informative, Doctor. In many places, there is no smoking board it is attached, but still we tend to be a passive smokers more
True.
commonly, Doctor. That's very true. Doctor, what are the symptoms for lung cancer?
See, What we must understand is by the time somebody develops symptoms for lung cancer, the disease is in an advanced stage. It is usually stage 3 or stage 4. Early lung cancer, that is stage 1 and stage 2, is seen in less than 10, 15, or 10, 20% people. That is usually because they go tested for some other condition. They get a CT or an X-ray for some other reason, and they pick up a mass in the lung or a tumor in the lung, and they get evaluated. But if there is a tumor and someone develops symptoms, what are the symptoms? Cough for a very long duration, which is not improving, pneumonia, which is not improving despite antibiotics, breathlessness, that is, difficulty breathing sitting or while walking on the level ground or while walking stairs or even while talking, or if the disease spreads to other organs, like if it goes to the brain, somebody may have constant headache, seizures or fits, or weakness of the limbs. If it goes to the bone, they may present with back pain. So these are all the common symptoms of advanced lung cancer. They may have shoulder pain, they may have rib pains. So if the tumor in the lung involves the nearby nerves and the nearby bones or the joints, so patients presenting without symptoms is very rare, but by the time they present with symptoms, they are usually stage 3 or stage 4. And cough, breathing difficulty, pneumonias which are not improving, bleeding in the sputum, which is called hemoptysis, or spread to other organs leading to those symptoms are common symptoms to watch out for lung cancer. So, in the clinic, if you see someone with a cough, with a pneumonia, with breathing difficulty, which is not improving despite antibiotics, when you have ruled out that the heart is fine, there are no cardiac causes, or other lung related issues, or kidney related issues, and if on the X-ray or the CT, if you find a tumor or a mass in the lung, then we should suspect lung cancer.
That was quite an informative point, doctor, because many of the times patients do get confused that, oh, it is just normal cough and cold, but they end up having chances of ending up with lung cancer, doctor. Doctor, how to diagnose lung cancer?
See, we diagnose lung cancer one based on imaging, that is scans. So we do an X-ray first. You find a small lesion or a mass or a tumor in the lung. Then they will need a CT scan or a PET CT scan that gives more clarity. It also tells us which part of the lung it is, where it has spread to the nearby areas, whether there is any fluid around the lung, fluid around the heart. So these are all causes of spread for lung cancer. So it tells you, the scan will tell you whether there is a tumor or a mass lesion, which lung, right or left, which part, upper or lower, whether it has spread to nearby lymph nodes or other areas, and whether there is fluid or not. But a scan is a photograph. It only gives you an indication that you may have cancer. It is not a full proof. So for full proof, we need to do a biopsy, which is a needle test. On the biopsy, we send it to the lab. Once we confirm whether cancer cells are there, you do something called immunohistochemistry to rule out two common types of lung cancer: small cell and non small cell. In non small cell, there are again different types like adenocarcinoma, squamous carcinoma, large cell carcinoma. If you suspect the disease has gone to the brain, you will do an MRI. If there is fluid around the lung, the water is taken and sent for testing to see for cancer cells. So all these tests are used to diagnose the cancer, to type of the cancer, small cell versus non-small cell, in non-small cell what type, and when you scan, you see where it has started and where it has spread. Finally, in today's latest, with all the latest advancements we have, we do something called molecular tests on the tumor specimen, especially in non-smokers, to look for certain mutations called EGFR, ALK, ROS, etc. And these are done on the tumor tissue. So all these tests help us in the diagnosis of lung cancer. A CT or a PET CT report should be available the same day or the next day. Biopsy will probably take 4 to 5 days to come, and the molecular report should take anywhere between 7 to 14 days to get the final report.
Doctor, before we move on to the second question, there is one question in the audience by Mr. Nivas MD. I heard that lung cancer only affects older individual and that too chain smoke.
No, that's not true. So, yes, earlier it was true. We used to see advertisements where people smoke and it was clearly put up warning for lung cancer. Today, you see almost 40 to 50% of lung cancers in never smokers, like women, men who never smoked. Number one. Number two, you see a very lot of young people too with lung cancer, maybe is in their 40s, in their 50s. So it is not true that it is only due to increasing age or only if you smoke you will get lung cancer. We have to watch out for the symptoms. No age is exempt, and we see a lot of patients who are non-smokers too developing lung cancer.
I hope that is the question. There is, Doctor, one more question from the audience. This is from Lavanya. She is asking, does having a family history of lung cancer means I am destined to have it?
Family history, see, imagine my grandfather was smoking, he had lung cancer. My father was smoking, he had lung cancer. Then that is not family history. That is due to their respective habits, they have developed lung cancer. So that is not family history just because two people in your family have lung cancer. So family history is more important in diseases like breast cancer, ovarian cancer, prostate cancer, pancreatic cancer in a few cases. Lung cancer, not that much. But yes, in some studies, they have seen for no reason. They've not been able to find a reason, but they've been able to find few people in the family being affected. But there is no specific reason for that, and you cannot recommend any test to detect it early.
I hope, Doctor, that was a clear-cut information given to those respective people. Coming to our questionnaire session, Doctor, what are the different tests available for lung cancer?
So we just discussed those tests. We will do imaging, which is either X-ray or a CT scan or a PET CT or a brain MRI, and the molecular tests, the biopsy, and the immunohistochemistry tests. With this, we complete the diagnosis of lung cancer, whether you have lung cancer, what type, small cell, non-small cell, your stage of lung cancer, and are you EGFR positive, are you ALK positive, are you ROS positive, or other mutations like RET, MET, etc. And if somebody is having PDL1, there is a test which is done on the tumor. If that is also high, that tells us whether this patient is a candidate for immunotherapy. So all these tests tell us the stage, type of lung cancer, and also guide us what kind of treatment we have to give.
Doctor, then what are the stages for lung cancer?
So, like most diseases, to keep it very simple, it is stage 1, 2, 3, and 4. So, come reverse. Stage 4 is advanced lung cancer. Cancer has spread to the opposite lung. Cancer has spread to the brain. It has spread to the liver. It has spread to the bone. Any of this is stage 4. Or if there is water around the lung, which is positive for cancer cells. Stage 3 means the cancer is in the lung and it has spread to nearby lymph nodes. Stage 1 and 2 means it's a very early small tumor. It's a very early stage lung cancer. So, broadly, stage 1 and 2 is in the lung. It has not spread beyond the lung. Stage 3 means it has spread to nearby lymph nodes. Stage 4 means it has gone to different parts of the body.
Doctor, what are the broad treatment aspects for lung cancer?
So, broadly, what we should understand is if we are in stage 1 or stage 2, surgery is the treatment of choice. Now, whether you can do a surgery for this patient, whether this patient is fit to undergo removal of part of the lung, that's a different question. So, you may be able to remove the tumor, but you should also remove a part of the lung. I may be a chronic smoker, my other lung also may be bad, so I may not tolerate the lung surgery. That's a different question. But the whole point is, can you do a surgery or not? So, surgery is a treatment option, but only in early stages. When it comes to stage 3, you use chemotherapy and radiation both. When it comes to stage 4, we either use chemotherapy. If there is no driver mutation positive, we spoke about all the mutations, you do those tests. If all those mutations are positive, you give targeted therapy, like tablets, they are called, or similar, they are like, which is also known by the name as TKI, tyrosine kinase inhibitors. So, specifically for a mutation, you will target a particular drug. If there is no mutation, driver mutation negative. Driver mutation is a mutation which is driving the cancer. If that is negative, you will give chemo. If you are PDL1 positive, you can give immunotherapy. So broadly, these are the treatments. Stage 1 and 2 surgery, stage 3 radiation and chemo, stage 4 chemo, TKI or immunotherapy.
That was very informative point, Doctor. Doctor, what is the how to treat stage 4 lung cancer to be more specific?
So as we discussed again. So stage 4 is advanced lung cancer. Stage 4 is not curable. Cure means your disease should come down and it should never come back again. In stage 4, even if your disease becomes zero, at some point it will relapse again. So you're trying to control the disease, decrease the disease burden, improve the quality of life, and prolong the survival of a patient. So if you are a non-smoker, if you are a woman, there is a high chance you have driver mutation positive. So if you are EGFR positive, we will give you medicine for that, like osimertinib or geftinib. They are all tablets. If you are ALK positive, you will receive a medicine for that called alectinib. If you're ROS positive, you will receive a medicine called crizotinib. These are all tablets. They are specific for that mutation. Chemo need not be given to these patients. These tablets are very safe. They don't have any side effects like chemo, and these patients generally do well compared to chemo patients. If you are a chronic smoker, there is a high chance that your mutations may be negative. That means you have to give chemotherapy. Chemo is usually given for 4 to 6 cycles, and in certain cancers like adenocarcinoma, the chemotherapy is continued without side effects, which is called maintenance chemotherapy. In both these cases, you will continue treatment and at every 4 6 months do a scan. If the scan is good and you are doing well without any side effects of treatment, either the TKIs are continued or the chemo medicine, which is called pemetrexed, which is the name of a medicine for a specific type of lung cancer called adenocarcinoma, that is continued. The day your scan becomes bad or your disease increases, the medicine is not working. That means you have to change the medicine. So that is broadly how you treat. And if you are high PDL1 above 50% or so, then you receive immunotherapy, which boosts your immunity to kill cancer, and it has no side effects of chemotherapy, safe, has an excellent response, has a different set of side effects like thyroid problems, liver enzyme problems, skin issues, but they can be managed.
Thank you, Doctor. Doctor, there is one question from Lavanya as well as Sumashri asking the same similar kind of a question. Does smoking causes lung cancer? And another is, does only smokers get a lung cancer?
So smoking for sure causes lung cancer. The more you smoke, the higher number of pack years. I told you, if you smoke 5 packets of cigarette every day for 10 years, 50 pack years. 5 packets of cigarette for 30 years, 150 pack years. More the pack years, more the risk of smoking. Okay. Many people come, they smoke, they don't get lung cancer. They are lucky. People who don't smoke, they get lung cancer. It is unfortunate. Does only smoking cause lung cancer? No, we discussed that. You can be exposed to asbestos, you can be passive smoking, you can be never smoker, radon exposure, etc.
Thank you, Doctor. Doctor, what is driver mutation positive cancer?
So driver mutation is there is a mutation which is driving the cancer, which is seen in a specific type called adenocarcinoma in women, in or men who do not smoke. So these people have certain mutations which pushes the cancer or which is responsible for the cancer. The common driver mutations are EGFR, ALK, etc. For these driver mutation cancers, block the mutation by giving a drug. You don't need to give chemo, which kills all the cells, which has lot of side effects. You need to give a specific agent which will go and target the driver mutation, and for a longer period of time, you will get a response. One day or the other, this mutation will develop resistance. That time you have to change your treatment, but that may be after 1 year or after 2 years or maybe even later.
Okay, Doctor. Doctor, there are different immunotherapies available for lung cancer. Can you just give a brief enlightenment on that?
So see, immunotherapy is a new treatment for lung cancer. We have started slowly moving away from chemotherapy. As I told you, in driver mutation, we don't give chemo initially. If you have high PDL1, we will ask you to take immunotherapy if affordable and if it is possible. Multiple drugs are there. Now you have 2 3 drugs in the market, and these drugs have a very good response. They shrink the tumor, they help in increasing the lifespan of a patient. The patient doesn't have side effects of chemotherapy. What it does is, there is a on the tumor and on the cell, there is something called PD1 and PDL1, which are receptors. It goes and blocks this particular area, because of which the cancer cell is killed. So if your PDL1 score is more than 50% or between 1 to 50%, you are eligible for immunotherapy. It's an injection which is given once every 3 weeks in a bottle of saline.
That was an important point to be noted, doctor. Doctor, what is radiation therapy in lung cancer?
So, as we discussed, radiation is a treatment for radiation is of two types. Are you giving radiation for local control, which is given in stage 3 lung cancer, or radiation in stage 4 is given for the brain or for the bone to control pain or to shrink the tumor which has spread to those areas. So, with both these things, what you are trying to do is you are either controlling the disease locally or in areas where it has spread, like the brain and the bone.
Doctor, then what is the prognosis for lung cancer patient?
See, the prognosis for lung cancer, I'll talk about advanced lung cancer. So, if you look up at stage 3 lung cancer, more than 70 or 80% of patients still do recur. They still have a chance of the disease coming back. So, that is how it is. But when you look at stage 4, though it is not curable, we have moved away from chemotherapy. Side effects of chemo are no more there for patients, for a few set of patients. And driver mutation positive patients have an excellent survival. They do very well compared to patients who need chemotherapy. The side effect profile is excellent. They are on tablets. Don't need to come to hospital for chemotherapy. So in that way, the prognosis has for sure improved in lung cancer in the last 10-15 years.
Okay, doctor. Doctor, there is one query from the audience. By World 2024, lung cancer is always a death sentence.
So yes, that's a harsh word. We have patients with lung cancer who are surviving for more than 6-7 years, who are teachers, who are in administrative posts, who are able to do their job daily, taking all the stresses of their work. So it is not that lung cancer is a death sentence that if you say today I have lung cancer, I'm going to die in 3 months or 1 month or tomorrow. It depends on what your general condition is, how your fitness is, number one, what your other problems are, how your kidney, heart, lung, other areas are, whether you're a smoker, non-smoker, your age, and how much disease you have. Do you have a lot of disease or you have minimal amount of disease? Whether you're driver mutation positive. So somebody who is driver mutation positive, never smoker, limited burden of disease will do excellently well. Now, ALK positive lung cancer, EGFR positive lung cancer survive more than 4 years, 5 years, and they're able to discharge all their duties. So to say lung cancer is a death sentence is a very harsh word.
Rightly addressed, doctor. Actually, even reading that was a little bit painful, but yes, cancer is a little bit of a painful, I think. And
So
as
the
I
bottom
heard, like
line is cancer is curable if detected early. That's the bottom line all of us should remember.
that was something, doctor, an interesting questionnaire session. Like we almost came to an end to the session. Doctor, your holistic approach to the patient care, addressing not only the physical but also mental and physiological aspects to the patient, doctor. Thank you, doctor. Doctor, would you like to give some of the closing statement for this lung cancer awareness month?
I would only emphasize that please quit smoking. Smoking causes multiple types of cancer, close to 16 varieties of cancer. Quit smoking. And if you have a chronic cough or a chronic lung issue which is not getting solved, show to your doctor. Doesn't mean you have lung cancer, but show to your doctor. Be aware. Remember, it can be seen in non-smokers and women also. So don't think that just because a woman has a mass in the lung, it is not lung cancer. It could be TB. In India, we get treated for TB for a very long duration and then diagnosed as lung cancer. So be aware. Don't be fearful. No need to be scared of any disease, but be aware. Thank you.
Thank you, doctor. Thank you for your valuable insights and your dedication to quality care that you really provide to your patient, which is uncommendable, doctor. Thank you all for being a part of this enlightening session of lung cancer awareness. So, doctor, as we conclude, just a message to the people, it's let's forward this newfound understanding and continue to spread the awareness, not only for this month, also if possible for the entire year. Thank you very much.